we'll start about neutrophil homeostasis. What is this neutrophil homeostasis? Homeostasis is nothing but the maintenance in an equilibrium state. Okay, so how the neutrophils are maintained in an equilibrium state, and what happens if the neutrophils has been in an exaggerated response or disequilibrium state, that we'll discuss in coming lecture. So first, the neutrophil gets its development from bone marrow. Okay, so the bone marrow consists of a ligand in it around the stromal cells. Okay, the bone marrow consists of a cell called stromal cells, which has a ligand which is called CXCL12. Okay, this is the ligand. Okay, and inside the bone marrow you have a neutrophils, right? So this neutrophils will have a receptor which is called CXCR4 receptors. Okay, now the interaction between the stromal cells and the neutrophils happens with the help of granulocyte, okay, colony stimulating factor, okay, which is called GCSF, okay, granulocyte colony stimulating factor. So from end of this thing, you have to know that the bone marrow consists of a stromal cells. In that stromal cells you have a ligand which is called CXCL12. Okay, ligand is nothing but it's like a phone call. Okay, it's giving a ring to the receptor present on the neutrophils. Okay, so the phone call has been received or a message has been received to the neutrophils. Okay, so with the help of CXCR4 receptors. So the crosstalk and all this interaction is happening between the stromal cells of the bone marrow and the neutrophils with the help of important factor which is called granulocyte colony stimulating factor. Okay, so this leads to what happens? This leads to maturation of neutrophils, as well as from bone marrow the neutrophils sends to blood vessels. Okay, so with the help of this colony stimulating factor, the neutrophils differentiation and maturation happens, as well as from the bone marrow the neutrophils started going to the circulation. So next you have to ask a question: who increases this granulocyte colony stimulating factor? So you have to ask a question: who increase? The main culprit who increases the granulocyte colony stimulating factor is that macrophage. Macrophage will release interleukin 23. Okay, what is this interleukin 23? From the name interleukin, cell to cell communication protein has been released by the macrophage. Okay, so it releases the message which is interleukin 23. This interleukin 23 will send a signal and a message to the T helper 17 cells. So once the message and the signal has been received by the T helper 17 cells, this T helper 17 will again send a message through a protein called interleukin 17. So this interleukin 17 is a major culprit to increase the colony stimulating factor for the production of neutrophils and to increase the production as well as to send the neutrophils towards the circulation. So this is the loop. It's a positive loop. Now next we are discussing a negative loop. What is this negative loop? If the macrophages keep on sending a signal with the help of interleukin 23 and again the T helper 17 is receiving it and it's sending interleukin 17, this interleukin 17 is keep on producing colony stimulating factor, automatically what happens? There will be a more number of neutrophil production. So there will be always a compensatory mechanism to keep the neutrophils production in a equilibrium state. There is a negative loop. What happens? After the neutrophils enters into the circulation, okay, it will go to the endothelial cells, and from the endothelial cells it reaches the injury or infection site. After it engulfs the bacteria and kill the bacteria, now the neutrophils have finished this function. So now the function of the neutrophils has been over. If the neutrophil stays in the tissue, there will be more number of inflammation will be there. So once the neutrophils has finished its function, automatically there should be a resolution of inflammation should start. So the neutrophils has to die with the help of apoptosis. What is this apoptosis? After finishing the function, the neutrophil kills the bacteria and its function has been over, the neutrophil will go for a programmed cell death. Okay, why this programmed cell death should happen? If the neutrophils keep on staying in the tissue, there will be more number of inflammatory mediators like pro-inflammatory cytokine, interleukin 1, interleukin 6, tumor necrosis factor alpha. All this keep on producing it, and more number of neutrophils again come to its injury site, because the body doesn't know that the neutrophils have finished its function or killed. So once the neutrophils has finished its function, automatically the neutrophil has to go to the programmed cell death, which is called apoptosis. So once the apoptotic neutrophils stays there, okay, the apoptotic neutrophils membrane is covered by phosphoidylyl serine. This serine will help the macrophage to engulf this apoptotic neutrophils. So this process is called efferocytosis. So what is this efferocytosis? If anyone asks, or you have to know that the apoptotic neutrophils is engulfed by the macrophage. That is called what? Efferocytosis. Once the macrophage has been engulfed the neutrophils, apoptotic neutrophils, this macrophage is changed from M1 to M2. What is this M1 macrophage? M1 is mainly a pro-inflammatory macrophage, whereas M2 is anti-inflammatory. So it is changing from M1 to M2. The main reason is that the resolution of inflammation should come. So the tissue has to come to its original activity. So there is a change from M1 to M2. So this is called the fate of homeostasis. If any disturbance happens in this homeostasis, automatically there will be exaggerated response that leads to chronic inflammation where there is no resolution happens. So in all periodontitis cases, okay, or most of the periodontitis cases, you won't have a resolution of inflammation. There is a chronic inflammation because this apoptotic neutrophils cannot removed by the macrophage, because the bacteria is keep on multiplying it. So neutrophils cannot able to kill the bacteria in the case of neutrophils, in the case of periodontitis. So what happens in the case of periodontitis is that the bacteria is keep on multiplying it. So the neutrophils cannot able to do its function properly. So there is a phenotypically switching happening, or phenotypically reprogramming happening, where the neutrophil stays for the long time or long duration in the tissue. This leads to a more number of inflammatory response happening, again a lot of neutrophils coming to the site of infection, and this leads to senescent neutrophils. What is this senescent neutrophils? Senescent neutrophils is that old age neutrophils where the function cannot able to do it, where the neutrophils cannot able to do the function. So this senescent neutrophils can die with the help of two mechanisms, which is called necrosis. What is this necrosis? Necrosis is an uncontrolled cell death, whereas apoptosis is a programmed cell death where you won't have an inflammation in apoptosis, whereas in necrosis you will have a inflammation. So only in all periodontitis cases you will have a chronic inflammation, because the neutrophils are dying in the mechanism of necrosis, where its contents gets leaked, where the neutrophils contents gets leaked while dying. So this causes the collateral tissue damage in the periodontium. What is this collateral tissue damage? For example, the necrosis, the neutrophils are died in the mechanism of necrosis. Cell membrane is got ruptured. Once the cell membrane got ruptured, automatically the inside content of the neutrophils will come outside of the cell, which is called extracellular space. So this content, which consists of all this DNA materials, chromatin decondensation materials, histone materials, as well as all this antimicrobial peptides. All these antimicrobial peptides are rich in acid, okay, that also can lead to a collateral tissue damage, which leads to weakening of the periodontium. So only clinically you are able to see in periodontium there will be a clinical attachment loss, pocket probing depth is increased, and you will have a recession as well as tooth mobility and bone loss. This is reason because mainly because of the reason of collateral tissue damage, because of this senescent neutrophils. Senescent neutrophils are mainly cleared by necrosis only, okay. So there will be a chronic inflammation. So end of this neutrophil homeostasis, you have to know 4 important key points. First key point is that where the neutrophils has been produced. The neutrophils is mainly produced in bone marrow, okay. So there is an interaction between the matured neutrophils inside the bone marrow and the stromal cells of the bone marrow. There is an interaction is happening with the help of granulocyte colony stimulating factor. Next important thing, who is going to increase this granulopoiesis activity? Mainly macrophage releases interleukin 23, okay. This interleukin 23 will take a signal from the macrophage and gives to the T helper 17. Once the T helper 17 receives this message with the help of interleukin 23, which is released by macrophage, the T helper 17 will release interleukin 17. So thus the interleukin 17 will increase the production of granulopoiesis with the help of colony stimulating factor. So this colony stimulating factor will increase the interaction between the stromal cells and the neutrophils, thus leads to neutrophil production, as well as it sends the neutrophils towards the circulation. Once the neutrophils comes to the circulation, it has to reach to the site of injury. So it is reaching towards the injury, and after the neutrophils has been reached to the site of injury, it does the job which is called killing. Once the neutrophils has killed the bacteria or whatever the microbes, now the neutrophils automatically go into the state of clearance with help of apoptosis. Once the apoptosis neutrophils has happened, the macrophage will engulf the apoptotic neutrophils, and thus the process called efferocytosis. Once the neutrophils has been engulfed by the macrophage will shift into M1 to M2, which is called pro-inflammatory to the anti-inflammatory. So this is the normal fate mechanism, normal homeostatic mechanism. In any chronic inflammation diseases, the neutrophils cannot able to kill the bacteria. It keep on clumping and it stays for the long duration on the tissue. Automatically the more inflammation will be there. So what happens? The macrophage cannot able to engulf the neutrophils. So neutrophils will go into the killing activity with the help of necrosis, where the release of all the neutrophils content into the extracellular space, which leads to collateral tissue damage in the periodontium. So only clinically you are able to see all the bone loss, clinical attachment level, pocket probing depth. So next we will move into granules. I already told the primary granules, secondary granules, tertiary granules. So main thing I want to tell in primary granules, myeloperoxidase. See this myeloperoxidase, which is going to increase the ROS. What is this ROS? Reactive oxygen species. So next we will go into secondary granules. I already told it has a receptor which is called VAMP. What is this VAMP? Vesicle membrane receptors. Okay. So and another important thing in secondary granules is lactoferrin, iron binding granules. Next is H-cap. What is this H-cap? Mainly it's a heparin, okay, and FOX protein. It's very important protein which consists of, from the name itself you can split it into two. FOX, PH stands for phagocytosis, OX means oxidase. So phagocyte come OX proteins, okay. Next is tertiary. Tertiary I already told, MMP9. This MMP9 will cause collagen destruction in the connective tissue, which leads to easy extravasation of neutrophils towards the site of injury. Okay. Next, the secretory vesicles. I already told where this secretory vesicle has been present. I already told. See, the secretory vesicles has been bounded to the plasma membrane. So only I told it's a membrane bond. Okay, membrane bond. So this consists of FMLP. What is this FMLP receptors? So this FMLP, it's nothing but formyl methionine leucine, okay, phenylalanine receptors, which is mainly produced by bacteria. So this receptors is present on the neutrophils, FMLP receptors. So next we will move into what is the function of neutrophils. So the first function of neutrophil is adherence. Okay, what is this adherence? Why it is very important for neutrophils? So since we all know that neutrophils is running in the central flow of axial blood flow, right? So it is always in center. So it has to come to margin to leave the blood vessels and reaches the injury site. So we have to understand that neutrophils needs a adherence function. So how it is going to adhere? The main adherence function for the neutrophils is that the neutrophils consist of two proteins which is called integrins proteins. Main integrins in neutrophil is called LFA. What is this LFA? Lymphocyte function antigen 1. It is a integrin. Integrin is nothing but a transmembrane protein. From the name itself, integrin, okay, it is going to integrin, which is going to a adhesion protein. Okay, so adherence is mainly with the help of integrins, which is LFA, lymphocyte function antigen 1. Okay, so next is chemotaxis. How the chemotaxis is the main function? What is this chemotaxis? Chemotaxis, with the help of chemical signals, the neutrophils has to travel from the blood vessels towards the site of injury, okay, with the help of chemoattractants. So what is the importance of this chemotaxis? Chemotaxis, in a layman term, you have to know the neutrophils is coming out of the blood vessels and reaches the site of injury. That is called what? Chemotaxis. The main two important component in the chemotaxis are there. First, signals. The bacteria which releases FMLP. I already told formyl methionine leucine phenylalanine receptors, okay, which is present on the neutrophils. So the FMLP will be released from the bacteria and it is received on the neutrophil. That is one chemoattractant. Next, the neutrophils will find a gram-negative bacteria with the help of lipopolysaccharide. This is the second chemoattractant. The third important thing, the epithelial cells of the gingiva, for example, sulcular epithelium, okay, where the more continuous disease activity will happen. So the sulcular epithelium will release a signal which is called interleukin 8, which is a chemoattractant for the neutrophils. And how the neutrophils coming out, how the structure has been changed while coming out of the blood vessels towards the tissue. So in chemotaxis, the another two component you have to know is that filopodia and lamellopodia. What is this filopodia? So filopodia is nothing but it is a spike like structure, okay, which is made up of actin filament. Okay, this actin filament will pave the way for the neutrophils towards the site of injury. How? This filopodia consists of a sensor in it. Okay, what is the sensor? The neutrophils will think whether the signal is correct or wrong. Okay, so the neutrophils has to find the signal is correct, whether it is coming from the bacteria only or from the same cell. Same cell means what? Our own host cells. Okay, so it has to find whether the sensor is correct or wrong. So this filopodia will help the neutrophils, that sensor is coming towards this direction. So we have to go in this direction. This filopodia will tell the neutrophils. As well as lamellopodia. What is this lamellopodia? Lamellopodia is nothing but it is a actin filament where it is present in the fan shaped structure. This fan shaped structure helps the neutrophils to move towards forward. Okay, you have to ask a question, how the neutrophils moving? How the neutrophils moving forward with the help of lamellopodia. So the end of this chemotaxis function, you have to know 3 important points, that bacteria will send a signal, okay, for the neutrophils to come out of the blood vessels, as well as sulcular epithelium will send a signal which is called interleukin 8, and third thing, how the neutrophil is coming out with the 2 components, mainly filopodia, which is an actin polymerization, which helps the neutrophil to sense the signal which is correct or wrong, and lamellipodia, which helps the neutrophils to move forward towards the injury or infection site.